Hello, everyone. Welcome back. So, if you joined the last two lectures, you'll know that this is a pre recorded lecture. It's still live, still on the cuff, but I decided to do a marathon and just get it done today because I'm so excited about this topic. The other reason that I'm pre recording is because when this premieres, I'll be on the premiere too, and then I'll be able to chat in real time with you. If there's comments, I can see it in real time and I can comment. So I'm really excited for that. And let's get started. Well, actually, let's go back. So, welcome to the channel. If you haven't been here before, this is Mentally Speaking with Dr. JB, where I do sessions about mental health content. Okay, great. So, before we're on the second part of the series. The first part of the series was about identifying if you or a loved one may have some type of psychiatric condition or mental health condition that you should seek help for. So that was kind of identification. Not so much self diagnosis, but just to have an idea of like, oh, I didn't even know that I should get checked out for that. That was the first part. Now, the second part, which is very exciting, is when to get help. Well, the first part was when to get help. So this is how to get help and what help will look like. So I'm very excited about sharing this. The last session was about therapy, and the session before that was like boots on the ground, how to get help. So referral sites, things like that. So go look back at those things. If you're trying to find a way to get help, it will be invaluable. So without further ado, let's get started with this lecture. Marathon time. So as always, I start off with what someone would come in the office saying. And this makes me think because this could resonate with a patient, but this is where I want to shout out all my mental health providers, all my medical providers, all my people out there in the professional world watching this. How are y'all doing? Thank you for supporting me because this is the type of things we see when people come in the office asking us, what is CBT? What is this? What is that? So even if you are a psychiatrist or fellow mental health provider, private care provider, what have you, interfacing with patients that have mental health needs, you can even refer these lectures yourself. And it could be additional resource for your patients, but not only your patients, for yourself to be like, hey, how do I explain this in a easier way than I might be? Or how do I explain this at all? Or what is that? Because I don't know myself. We don't know everything, but hey, this is what education is for. So it's for all of us. What is CBT? So this will be a discussion about the different therapy modalities, or in other terms, different types of therapy. This is not an all-inclusive list. These are just some common types of therapies that you may see on a website or that you might hear that a therapist is doing. This doesn't encompass everything, but these are the most common. So we have talk therapy, which is in a spectrum from psychodynamic therapy to supportive therapy. Don't worry, we will go through what the different types are. There's CBT, or cognitive behavioral therapy. There's DBT, dialectical behavioral therapy. There's IFS, or internal family systems therapy, motivational interviewing. And this isn't that common, but because I'm trained in it and it's near and dear to my heart, I also included EMDR, which is eye movement desensitization and reprocessing therapy. What a mouthful. But let's get into it and I'll explain them all. So we have psychodynamic therapy. So psychodynamic therapy is insight oriented and focuses on helping patients understand unconscious processes that influence their thoughts, emotions, and behaviors. So essentially, you're talking, and through the talking, you gain greater insight on what's behind your emotions, what's behind the things you do, and what's behind the thoughts that you're having. So, what are we talking about? You're often exploring early life experiences and relational patterns, how these patterns show up in current relationships. And then there's a big part of this, which is examining the relationship between you and the therapist themselves. The goal is increased self-awareness and long-term personality change. So this is the type of therapy that people usually do either ongoing or for years at a time. And another term for this is I'm doing analysis or psychoanalysis. This is usually what people are talking about. Then there's supportive therapy, which I think most people think of when they think of talk therapy, even though psychodynamic therapy is a type of talk therapy. Supportive therapy is more focused on helping the patients function in the present. So sometimes you may talk about the past or the patterns in depth, but it won't be in depth actually. It aims to strengthen existing coping strategies and defenses. It provides reassurance, encouragement, and practical guidance. It's especially useful if there's like an acute crisis, an acute illness, or when the patient or the person is not able to tolerate digging up all that past trauma and everything that's in the subconscious. I forgot that I had this. So key differences: insight oriented versus stabilization oriented, interpretive versus practical and skills based, and then long term versus present focus. And even still, even though supportive can be present focused, sometimes that can go on for years and be ongoing as well. Actually, all of these, depending on how you do it, even though the skill based ones can be time limited, some people are in these modalities for years. So, for instance, skills based CBT, so cognitive behavioral therapy. So, CBT is based on thoughts, feelings, behaviors, and the way I like to describe it is those two-way arrows going between all the two-way arrows going between thoughts, feelings, behaviors, and how they're all connected. So, dysfunctional thinking patterns contribute to emotional distress and maladaptive behaviors. So, CBT helps patients to identify these patterns and replace them with more balanced and realistic thoughts. Because out of the three in the triad of thoughts, feelings, and behaviors, the one you can most target are those thoughts, and in turn affect your feelings, and then in turn affect your behaviors in a more adaptive way. The focus is usually current problem solving rather than in depth, going in the past. Key techniques. So patients learn to identify cognitive distortions. What is my thinking? Like, where's my thinking going wrong? What are these negative patterns? It could be black and white. It could be catastrophizing. It could just be that you're negative in general, that type of thing. And then behavioral strategies can include behavioral activation. So just learning ways to just behaviorally get there before your thoughts even get there. CBT also incorporates skills like problem solving and coping strategies. So CBT can be time limited and is usually structured, but some people incorporate, and you'll see this with DBT, incorporate elements of CBT in their practice, so it's not always so stagnant that you'll have a certain amount of sessions, even though that's how it was kind of designed. Some people kind of have an ongoing therapy. It's collaboration, it's active, and last but not least, they have homework. There's always homework. After every session, if it's true CBT, there will be homework after every session. So get ready for that. And the homework isn't like writing necessarily. It could be if they ask you to journal, but it could be like, think about how this played into your day. Think about what negative cognitions came up in the week, that type of thing. So it is very helpful to do the homework. All right, DBT. And we talked about DBT when we did the session on borderline personality disorder, but it can also be helpful for other personality disorders, but mostly it is designed for impulse control, specially designed for borderline personality disorder, but DBT can be helpful for a gamut of different individuals. So DBT is designed to help individuals who experience intense emotions and difficulties regulating them. So it is rooted in dialects. That's the first word, dialectical, which is holding two truths at once. And also, it may or may not say that, but also the two truths can exist, two things can exist, and also the gray areas in between them can too. So there is a way of gaining acceptance, patients getting acceptance of who they are, working towards meaningful change, validation, skill building is very big in DBT. So the way it's broken up is into modules, four main skills: mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. That is because a lot of people who engage in this therapy, they're really working on how to navigate relationships, set boundaries, and communicate needs effectively. The structure can be such that it's a group, and usually the group isn't like group therapy where everyone's going around. It's usually where they're just learning the skills. But there are levels to this where you might have a group where people are going around and talking about how they use the skills in that time, or individually. First, people do the skills, and then we'll talk about how they're using the skills in everyday life. So there's a lot of fluidity to these different modalities or these different types of therapy. So if someone tells you I'm trained in DBT, that doesn't mean they only do DBT. They could do a wide range of things, but knowing that they're trained in something particular means that they can give you certain skills from that modality. ISF, internal family systems. I want you to think inside out, specifically inside out too. I could not, if you see any of my past reels, I'd had a hard time getting through that movie on an entertainment basis, but psychiatric and psychologically, it was good. It was talking. It was explaining big concepts. And one of the things that it didn't really say explicitly, but kind of had that gist of like parts of self, um, was in that movie. So let's talk about internal family systems. So it views the mind as composed of different parts with its own perspective, emotions, and roles. So at the center is the self, which is calm, compassionate, grounded. And the goal of therapy is to access the self to develop a healthier and more balanced relationship with the other parts. So, what are the other groups? What are the other parts? Um, so they're the exiles, the wounded parts, the vulnerable parts. They're the managers, the protective parts, the controlling parts, and the firefighters, the reactive, impulsive parts, putting out the fires. So the focus is to think about that center self and how to work with all these other vulnerable parts. The structure. I like IFS because it is non-pathologizing, which means that it's not trying to put a pathology on you or put a diagnosis or put a label on it. It emphasizes curiosity, compassion, and internal exploration. So the therapist will guide you in identifying and connecting these parts, understanding their roles, and helping to unburden the wounded parts. It's more like an experience and experimental and insight oriented of the different therapies that I explained before. Speaking of something that's a little bit different, is motivational interviewing. I have this here because we did have previous lectures on substance abuse and also eating disorder. Eating disorder, CBT is actually the mainstay, but I think whenever it comes to a disorder where change, and we're trying to work on change, motivational interviewing is a huge component of that. So, motivational interviewing is patient centered. It's a patient centered approach to help that person explore and resolve ambivalence about change. So, rather than saying you should do this, you should do that, the practitioner, the provider, the therapist gauges the patient's motivation and commitment and just work through it. So, some key techniques: open ended questions, affirmations, reflective listening, and summarizing. There's a lot of listening and reflecting. The point is not to make the change and force the change, the point is to elicit change. So we talk, change talk. It's very collaborated and goal oriented and respects the autonomy and readiness for change. So if the patient isn't ready, we don't push it. We don't force it. We go with the flow. We go with the flow. And the purpose is eventually that patient, through this give and take, comes to a desire or a place of change. EMDR. I love EMDR. I've been trained in EMDR since 2018, and I absolutely love it. So EMDR has been found to be helpful with civilian PTSD, which means PTSD that didn't happen out of war. That's civilian PTSD. But there are so many uses for EMDR, like so many. Like you could use, if you look on like online or even see different people's profiles, they say EMDR for weight loss, EMDR for depression, EMDR for anxiety. You can use it for so many things. So let me go through what it is, and then we can backtrack to how that can be. So EMDR primarily is trauma-focused therapy in which it helps people process distressing or stuck memories. It's based on the idea that traumatic experiences may not be fully processed and can continue to cause distress in the background. So EMDR helps the brain in a natural way reprocess these memories so they become less distressing and more adaptive. So how do you do that? So EMDR uses bilateral stimulation. So sometimes it's like just moving the eyes, which is the eye movement part. That was the first thing, but it could even be tapping on both sides of the body or legs or what have you. It could be hearing tone. And while engaging in this stimulation, the patient focuses on the traumatic events, along with thoughts, emotions, body sensations, and over time, the goal is for those memories to be less distressing, and you also gain more adaptive beliefs. So one thing I want to caution here, there are self-EMDR apps, there are self-EMDR books. I think the self-EMDR books are just good to understand how EMDR may work and the evidence behind it. I do not recommend self-EMDR at all. I mean, if you are a licensed practitioner, you've weighed the pros and cons, you know. But for everyone else, I would greatly caution against self-EMDR because a lot of things can happen during that process that if someone's not around, like you're re-experiencing that trauma, may not be a good thing. So let's talk about the structure of EMDR. It can be an 8-phase process. For some people, they do it ongoing. For some people, it's like you're going to do 10 sessions and that's it. Some people, it's a couple of sessions and that's it. So that's very fluid. But that's usually like the standard bread and butter procedure of how to do it. There's a lot of, although it is present focus, it is addressing a lot of the past. And you always end up going back to the past to help with present issues. And then it's experimental in a way, and also guided processing. So sometimes it uses a lot of the imagination. Like a lot of mindfulness, a lot of meditation, a lot of open-mindedness. I love EMDR, but just like any of these therapies, any therapy, and that goes back to the last lecture where I tell you, you are not stuck. If it doesn't work for you, it doesn't work for you. So go back to your therapist and say, hey, this may not be working. It may be EMDR, it may be CBT, it may be psychodynamic, it might be supportive. Go back and say, hey, this isn't working. I want to try something else. So essentially, these are my review of the main types of therapy. And let me talk to you guys for a second. All right, thank you guys for joining. As usual, don't forget to support this channel. Like, subscribe, notifications when the lives come on. When this live come on, I'll be on there too. So I'll be able to chat, be in the chat. And even if I'm not in the chat or you see this like, who knows, a year from now, I'll still get the notification. If you ask a question, I can still answer if I deem it appropriate to answer. And then another thing is other ways to support the channel. Patreon, Udemy will have this material, but without all the fluff, without the, hey, powwows at the end, powwows at the beginning, explanation. It's just going to go right to it. It's also going to be more organized, especially on the Udemy into courses. And on the Patreon, you'll see it also organized. The other thing about the Patreon is it's not just you can get organization. Of course, Patreon is to support. It's kind of like really low right now at a price just to show my appreciation for believing in me so early. Thank you for anyone who watches this and supports the channel in that way. And the other thing is that it's not up quite yet, but maybe in the next, who knows, very soon, In addition to the edited versions of the lectures, up front on my Patreon, there's going to be all the content from my other channel. So I'm unlisting everything from my other channel and just putting it on the Patreon because y'all deserve that for supporting me. It's good content, but y'all just get it, boom, right there for you. So that's going to happen on the Patreon very soon. If you don't see it, you could wait out to do the Patreon, but it will be there. It's going to be there very soon. And then, yeah. So support the channel, like, subscribe, Patreon, Udemy. It is my pleasure. Don't forget to share these videos with someone who might find it helpful. I will see you next time. Bye.